I'm here with Dr. Nitasha Puri, a family physician and Paul's Goldcorp Fellow in Addiction Medicine. What prompted you to apply to this formal training program in addiction medicine?
I think there's a lot of reasons that prompted me to get involved. I definitely have a clinical interest in the disease of addiction. Not only is it really interesting in terms of, I shouldn't say interesting, but not only is it sort of engaging in terms of the medicine of it, but really more importantly, it's, I think, full of people and stories that are really rooted in a multitude of things that always attract me. And I think my interest also lies in not only providing clinical care, but also trying to work within the system to change it so that we can provide services that are actually more effective and more welcoming to people who have addictions. I think that we have a lot of room for improvement in our system. So those are some of the reasons. The fellowship itself is actually quite well structured, and there's a lot of really dynamic and engaging teachers as well. So that was another reason for applying to this particular one, and I'm really excited to be one of the first people to kind of go through it and help shape it and learn from the people in it. So that's some of the few reasons.
And how will this fellowship in addiction medicine help you provide better care to the patients you treat?
Well, I think that the fellowship is structured in such a way that we have a mixture of academic rigor, journal articles, journal clubs, sort of reading the literature around addictions, of which there's quite a lot, as well as balancing it with a bunch of different clinical experiences and learning from people with different clinical styles. So all that being said, I think we'll come out sort of trained and exposed a lot better than maybe I would have had I just sort of gone and had a job in family medicine with patients who have addictions. So undoubtedly the way that the program is structured and the exposure that we have and sort of the way that we're inspired to learn and to work and to kind of engage with addictions work, I think that's definitely going to help us provide better care to our patients. And as I mentioned, there's opportunities for advocacy, systems change, all that kind of stuff that I'd be interested in, that will obviously hopefully have a bigger, wide-scale impact on patients with addiction. So,
Thank you.